Thanks, Gary. What, could you just stay right up there? And Barbara, if you could join him, we will. We have 5 minutes or so for questions.
7, 10.
David says 7 or 10 minutes for questions. So, yeah, is Roy still online?
We get to answer his questions for him.
That doesn't. Anna, is Roy still online or? I know. Yeah.
Yes, I am. Can you hear me now?
Yes, we can,
I've just
Roy. Thank you.
unmuted.
So we can have questions for Roy as well. So the floor is open.
Rich Corsi question for Gary, and just for clarification question. When you compare the green housing with conventional housing, is it the green housing is brand new? Is the conventional housing also brand new?
Yeah, this is the challenge we have in doing this kind of work, is that we are really comparing, in a way we're comparing, maybe it's the worst to the best, but we don't have, it's not conventional new versus conventional green.
And,
So,
I've seen that with a number of other studies. It never seems like a fair comparison to me. When you're moving somebody into new housing, it may not be that it's green, that it's new.
right. Yeah, the only, I guess the only counter to that is, you know, in terms of these opportunities to provide better housing to these individuals, the question is, should we be even building new, conventional, and what is the best plan? And then, we're also just taking advantage of this opportunity. And so I also feel like the green new construction is not going to be the answer for all public housing in the United States. And so, there are things we can learn here that where we think about green elements, but it's an excellent point.
Thanks. Next is.
Sorry, this question is from Bill Nazaroff. It's a little bit larger maybe than just the material covered in the session, but I'm interested to hear your opinions. Over the course of the day so far, it seems we've had a little bit of potentially conflicting evidence about whether more ventilation is better or worse with respect to health risks of exposure indoors. In some of the presentations this morning, I don't remember whether it came from Charlie or who made the presentation, some of the epidemiologic data suggests that if the windows are open more or if you use less air conditioning, then maybe the risk factor is higher in correlating health risk to ambient air pollution. But of course, we also know that with respect to indoor sources like smoking, ventilation is key to helping reduce exposures, not sufficient in and of itself. So do you have any thoughts, any of the three of you, about is ventilation a good actor or a bad actor if we're trying to protect public health here?
Shall I come in on that one? This is Roy.
Sure.
I think to a large extent, Bill's answered the question that he's asked in that good ventilation, especially natural ventilation, is going to enhance the concentrations of the outdoor originating pollutants, whereas very poor ventilation, as we saw in that somewhat strange Birmingham building, very much curtails the concentrations of a large proportion of the particles. Whereas when we have indoor sources, clearly ventilation is likely to be beneficial in reducing the concentrations. So there's no simple answer. It's, I think, very much dependent on what internal sources are present in the home, and also whether one believes that they have the same toxicity as the outdoor sources.
Thank you. Barbara, you look like you want to say something.
Well, I'm not sure I should, but I think that what did they used to say in the old days before I was born? Dilution is the solution to pollution, right? And so I don't think ventilation itself is the answer. You know, certainly if you reduce emissions both indoors and outdoors, that's a better answer. And then, of course, the other answer to that question is the typical university answer, which is, well, it depends, right? So I'm sure that if I was living in downtown Beijing right now, I would reduce my ventilation and try and reduce my indoor sources at the same time, and make sure I have a really good filter on my forced air ventilation system or my air conditioning. And now, having just moved to North Carolina, I've discovered that if you don't cycle your air conditioning on a regular basis, you don't have to keep it cool. You just have to cycle it on every so often. You know, you will have a really big moisture problem really fast. And so I'm talking without answering your question, but I tend to think that ventilation is, from an air quality standpoint, in general, a good thing. And it's a complicated question.
Uh, David Rich?
So David Rich from University of Rochester. So just to throw an epidemiologist point of view in here, part of this, I think, as an epidemiologist, I always think about, when windows are open, I think of it in terms of bias, in a sense that I'm trying to look at a health effect associated with outdoor pollution, but there's less air, there's less exposure air, and hopefully less downward bias when you take into account whether or not windows are open or ventilation, air conditioning is being used. So just to throw that in there as well, there's also that, which obviously isn't necessarily talking about the actual levels, but just more about how risk estimates might be have less air and less bias simply just because of you have a better estimate of exposure.
I have one last question from Rich Corsi, I think. Did you have your hand up? No.
Jeff was.
Jeff, then one last question
Yeah,
from.
I've got.
He
So
looks
I
like the
mean,
final question.
we don't say dilution is the solution to pollution anymore. We say build tight, ventilate right, and I think that that's really the issue: is that ventilation is not equal, and the pathway that ventilation air takes into the building, we have opportunities for mitigation if we've got a properly designed ventilation system, and we have opportunities for control of ventilation to achieve lower particle concentrations indoors. So I think it's more a question of how we do ventilation than assessing whether ventilation is good or bad.
Well, I'd like to thank the speakers then, and David has an announcement.
Yes, for everyone here, we will be taking a break until 3 p.m. Eastern start. Thanks again to our speakers in this session, and special thanks to Roy Harrison, who stayed quite late in his office in Birmingham so that he could speak with us today.